So what actually works for Achilles tendon pain? Across most non-tear cases, the core is simple. You control the load enough to stop the flare. You progressively build strength in the calf and the tendon's capacity itself. You may need to strengthen accessory muscles and other things along with that because it may be compensating for weakness there. Achilles tendonitis is one of those labels that gets slapped on almost anything in the back of the ankle, and if you treat all Achilles tendon pain the same way, you're going to get mediocre results. Today I'm going to break down the 5 most common patterns we see in our office and how treatment changes depending on which one you have. I'm Dr. James Repko at Bayshore Podiatry Center in South Tampa. We see Achilles issues all the time, especially in runners and active adults, because the Achilles is actually a load manager. It doesn't like sudden spikes in training. It doesn't like a new activity like pickleball all the time when you haven't been doing anything or haven't been using it. It doesn't like poor recovery, and it does not like weak supporting structures because it compensates. It's going to take the load of what's not working right. So what are the 5 patterns? Number 1, sudden training spikes, like we said. This is the classic couch to 5K that just is over-aggressive. It's the pickleball player that gets going too quickly, an eager or tennis player that just picks up the racket after not playing for 5 years and thinks they can go back to playing the way that they were before. I'm guilty of it. I think we all are, but you got to be careful. So the treatment, what is it for this? You want rapid load management and progressive strengthening. You just decrease the load and strengthen it. It usually responds really well. The second type of Achilles tendon issue that we see is insertional Achilles tendon pain. And this is where the Achilles attaches to the back of the heel, and it can behave very differently because compression here and pressure plays a role. Usually what we do for this is modify stretching, and we load a little bit, but not too aggressively, because deep dorsiflexion, up and down plantar flexion can aggravate this more. The third type of Achilles tendon issue that we see is a mid-substance tendinopathy, which is where the pain is thickening in the tendon higher up than the heel. The treatment for this is progressive loading, eccentric loading, increasing load over time, and it responds very well to that. You have to tailor it to your tolerance, though. Pattern number 4, biomechanical abnormalities, whether it's gait, foot structure, posture, running patterns, something may be off. So what we do to treat that is we strengthen, we use supportive strategies. Sometimes it's orthotics, sometimes it's shoe modifications, sometimes it's a heel lift. It really depends on the individual and what's driving that issue. Issue number 5 is a big one and an important one, a partial tear. It's less common, but it's important that you know what it is. If you feel a pop or a sudden sharp pain in the back and you can't really use your calf the way that you normally would, you need to get an evaluation immediately. This isn't a time to rely on YouTube rehabbing to see if anything is wrong. So what actually works for Achilles tendon pain? Across most non-tear cases, the core is simple. You control the load enough to stop the flare. You progressively build strength in the calf and the tendon's capacity itself. You may need to strengthen accessory muscles and other things along with that because it may be compensating for weakness there. You address contributing factors like your footwear, training errors, recovery, possibly mechanics. If you treat it like inflammation with only ice and rest, you can calm the symptoms, but as soon as you get back, it's to whatever you were doing before, it's probably just going to come right back. And that's how it becomes more of a chronic issue. So you want to stay away from that. When do we actually escalate treatment in our office? If someone has persistent pain that has been doing the basics of loading and stretching, modifying shoe gear for weeks to months, we consider advanced options. And that may include imaging to confirm what we're actually dealing with, what type of tendon issue is going on. It could be ultrasound or an MRI. And in select chronic cases, we use things like focused shockwave therapy or biologics like PRP, depending on what the specific tissue state is, to help heal that and what the patient's goals are. What's our decision framework like in clinic? New Achilles pain with a clear training spike, like I said, you load manage. Slow down, take it easy, and then you progressively strengthen. If it's chronic, meaning it's greater than 6 to 8 weeks, and it keeps relapsing, you need a more precise diagnosis and a structured plan that is going to involve some type of adjunctive therapy, strengthening, stretching, combination of shockwave, possibly inserts, shoe modifications, things like that. It's very individual specific. Red flags with this condition: any pops, sudden sharp pains, get it checked immediately. Don't mess around with it. You don't want to rupture. So if you're in Tampa and you have Achilles pain and it's limiting your running, your walking, your training, your ability to play a sport that you love, soccer, pickleball, tennis, book an evaluation in the description below. You can go right to our website, book online. We have appointments available that you don't even need to call in. You're welcome to call in at any time, and we can help you book an appointment as well. Where we, I think, differentiate ourselves is we really try to cater the plan to you, the individual, and meet you where you are and not apply a strict algorithm. or treatment plan to everybody. We'll tell you what type of Achilles tendon pain you're having, why you're having it, and how we're going to fix it. So I hope you find this video useful, and if you're having pain, come see us.